Philippines, exposure to water pollution and poor sanitation conditions and hygiene practices account for one-sixth of the reported disease cases and nearly 6,000 premature deaths per year. The cost of treatment and lost income from these diseases amounts to 6.7 billion pesos per year. Diarrhea, which is one of the most prevalent diseases in the Philippines, is the most common health impact. Intestinal worms are similarly ubiquitous, with studies finding them in over 40% of children. Typhoid and cholera outbreaks are also common. The major cause of these diseases is poor sanitation and hygiene in the household. Currently, 25 million people lack basic sanitation, and 13 million people lack water sources that can provide improved drinking water and hygiene. Another risk is from the fact that nearly all the domestic wastewater in the country is untreated, which can expose people to parasites, pathogens, and bacteria in water supplies, agricultural fields, drainage systems, and surface water. The largest risk in the Philippines is among the 25 million people living in the households without sanitary toilets. In these households, there is a high risk that human waste would not be safely removed from the household. This risk, combined with hygiene habits such as washing hands before meals and after use of sanitation facilities, are the major risk factors contributing to diarrheal disease. Outside the household, the risk of exposure to human waste is on average lower. However, the lack of sewerage systems and operational wastewater treatment facilities throughout the country presents opportunities for direct contact with human waste and indirect contact through flies. In every city and many rural areas, water contaminated with human waste can be found in rivers, canals, bays, streets, and public walkways with poor drainage. Groups especially at risk are children who play in or near polluted water, and fishermen and farmers who are in contact with polluted water as part of their livelihood. Drinking water from unprotected wells or leaky pipe water systems contaminated by sanitation systems is also a risk in many urban areas where the water system have high levels of leakage. In rural areas, many unprotected wells located in proximity to human waste have been found to be contaminated. The quantity of water available to maintain personal hygiene and clean household surfaces in order to prevent ingestion of fecal matter is also an environmental contributor to disease. 30 million people lack improved water sources such as protected wells and public taps that can help ensure they have access to an adequate quantity of safe water. Additionally, another 50 million people lack individual water supply connections. Open defecation and improper waste disposal are leaving many water bodies and land contaminated with sewage. In addition to the risk of ingestion of feces, human contact with this waste is one of the main contributing factors to certain diseases that use worms or snails as part of their life cycle. These include schistosomiasis, which is commonly found in areas with irrigated agriculture in eastern Mindanao and the Visayas, where the snail is found. STH, or soil-transmitted helminths, which have been shown to reduce learning, memory, and verbal fluency skills in infected Filipino children, and filariasis, that causes debilitating enlargement of legs, feet, and other appendages. Another health risk from water pollution is paralytic shellfish poisoning, which is caused by consumption of shellfish contaminated with saxitoxin, which is present when they are harvested during blooms of marine organisms called dinoflagellates. The toxin causes neurological damage, paralysis, and in some cases, death. Studies worldwide have shown that programs to encourage the habit of washing of hands with soap can reduce diarrhea by between 30 and 50%. Recent evidence has indicated that pneumonia can be reduced by similar levels. Many septic tanks are poorly or improperly constructed without lining and underground filters. Moreover, to function as designed, septic tanks need to be maintained regularly in order to remove built-up solids. Nationally, less than 1% of tanks are known to undergo regular dislodging with acceptable treatment. Only 7 cities have piped water systems. These systems cover a small percentage, between 1 and 15% of their respective populations. As a result, 95% of wastewater flowing from households directly or via septic tanks is transported into groundwater or into public canals and drainage systems, and eventually into rivers and other water bodies. While household connections have expanded nationally, they have not been able to keep up with population growth, resulting in an increased use of water peddlers, trucks, bottled water, or water refilling stations. 12% of the population in urban areas is dependent on these alternative sources of water. Studies of groundwater quality found that 58% of the sampled groundwater tested positive for coliform bacteria. Surveys of LGUs have also indicated that one-half or more of their public water systems do not meet the drinking water quality standards. Fortunately, over the past 15 years, there have been important improvements. Since 1990, the proportion of the population with access to basic sanitation has increased from 57 to 72%. Access to household water supply connections, which has been shown to increase the amount of water available for hygiene purposes, increased from 26 to 40% nationally, and is now 58% in urban areas. At the same time, over the last 10 years, the incidence of several water pollution-related diseases has declined substantially. Reported diarrhea incidence has decreased by 43%, and hepatitis A has dropped by 70%. Reported incidence of schistosomiasis, a disease that uses a snail intermediary and is spread through exposure to human waste, has also dropped substantially to 40% and is now contained to a few regions. outdoor air pollution in urban areas and indoor air pollution is also affecting health, accounting for an estimated 5% of all reported disease cases and 4% of all reported deaths in the country. Air pollution primarily causes respiratory diseases, including acute and chronic bronchitis, pneumonia, and cardiovascular diseases. The impact on the economy from health expenditures and lost income is estimated to be 7.6 billion pesos per year. Levels of particulate matter, a significant health concern and indicator of high levels of other pollutants, are estimated to be on average 3 times higher in urban areas than in rural areas. Over 18 million people in the Philippines live in cities with unhealthy levels of airborne particulate matter. Due to its large population and high air pollution levels, Manila has the largest health burden from air pollution. 84% of particulate pollution is from motor vehicles, particularly motorcycles, tricycles, and utility vehicles such as jeepneys. Indoor air pollution is a health risk in both urban and rural areas, as people spend a large portion of their time within the confines of their homes. 46 million people in the Philippines use wood as cooking fuel, which increases their risk of exposure to particulate matter, polycyclic aromatic hydrocarbons, and carbon monoxide in households and kitchens. Use of these fuels in confined environments has been shown to substantially increase chronic bronchitis, lung and throat cancer, and susceptibility to respiratory illness. 35% of Filipinos and 56% of males are smokers. Additionally, 56% of school children have parents that smoke. While the impacts on air quality and health have not been systematically assessed in the Philippines, in Manila, it was found that children with fathers who smoke have a 60% higher risk of asthma. Also known as secondhand smoke, is a combination of exhaled smoke from active smokers and the smoke coming from smoldering tobacco between puffs. ETS contains the same toxic components as mainstream tobacco smoke, although in somewhat different relative amounts. In 2002, WHO evaluated all published evidences related to tobacco smoke and concluded that there is a clear scientific evidence of an increased risk of lung cancer in non-smokers exposed to ETS.
Sa mga pangunahing sanhi ng kamatayan sa Pilipinas, malaki ang ginagampanan ng polusyon sa hangin. Ang mga pinsalang nagmumula sa kapaligiran ay kakibat na rin ng kahirapan at kawalan ng pagsulong sa ekonomiya mula sa tirahan, lansangan, lugar ng trabaho at maging sa pagbalik sa bahay. Ang mahahalagang sanhi ng polusyon sa hangin ay usok ng sasakyan, pagsusunog, paninigarilyo at alikabok sa daan. Sa mga kamatayang sanhi ng mga sakit sa baga at puso, malaking bahagi ang dulot ng dumi sa hangin. $281 million kada taon ang nawawala dahil sa maagang pagkamatay, sanhi ng mga sakit na to.
Pollution is everywhere and everyone in the metropolis is exposed to air pollution. Mahirap na nga ang buhay. Yung iyong kalusugan, yun na lang ang iyong asset.
trends and interventions over the past 10 years have improved air quality. The closure of a number of coal-fired power plants near Manila in 2001 has led to a reduction in sulfur dioxide concentrations. In addition, the phase-out of leaded gasoline has led to a tenfold reduction in ambient lead levels since 1990. More recently, the implementation of Clean Air Act has introduced fuel standards that would reduce aromatic and benzene in gasoline and the sulfur content of automotive diesel fuel. In 2003, the government also established hydrocarbon emission standards for motorcycles and tricycles in urban and rural areas and began requiring emission testing before registration of motor vehicles. In terms of indoor quality, over the last 10 years, people have been switching from traditional solid fuels to the cleaner burning liquefied petroleum gas.